Many of us are aware of what workplace violence looks like in healthcare. Sometimes it is physical assaults, it can be verbal assaults, and it can even move into threats and stabbings and shootings. But what we don't talk about a lot is the workplace incivilities in between coworkers and what they are. My name is Chris. I have been a nurse for the last 15 years. I've been in ER, either on the floor or in leadership, for the last 14. I've worked in both union and non-union arenas. And the idea is the same. Everyone wants to give really good quality care to their patients, and they want to do it in a healthy and safe work environment. So what I need to do is educate you on what workplace incivilities look like. I need you to be able to recognize those. Then we need to talk about how to get your staff to be able to respond to these when they happen. And then let's discuss what you need to do about this situation. So workplace incivilities are usually either speech or behavior. Speech would be lying, gossiping, name calling, things like that. And the behavior could be anything from eye rolling to making sure that somebody does not belong on the team, kind of in the group. And sometimes it's even sabotaging someone's work. So what I need you to know is that 70% of nurses say that they have been bullied at some point in their career. And 40% of those nurses have never told their supervisor. So this is going on whether you are aware of it or not at the moment. What happens is that the staff that are bullied are less productive, they have more anxiety, they call out sick more, and if it gets really bad, they will actually end up quitting their job. This affects your budget in the fact that financially now you have to go out and seek another nurse and do orientation all over again. You're going to have to backfill all those spots with probably overtime for the other nurses. Failure to address these issues can actually give your staff the idea that you are okay with this kind of behavior, and it allows them to keep acting this way. So there are some examples of what workplace incivilities are. I think everybody, if you think about it, can actually come up with an idea of what's happened or what you've seen happen that could constitute workplace incivilities. So this is what I need you to gain from this. I need you to be able to recognize what workplace incivilities are. I also need you to be able to build up your staff, to make them strong if it happens, and then I would like you to know what to do as leadership and how to hold people accountable for this. So workplace incivilities, like I said before, can be speech or it can be behavior. So there's all kinds of different things of speech. It's insulting, it's rude, it's gossiping, it's rumors, it's back talk, things like that. The behaviors can sometimes be as covert, but usually they're ignoring people. They're making sure that that person doesn't feel a part of the team. They aren't discussing patient care with them, and even sometimes sabotaging their work. So workplace incivilities can be covert and they can also be overt. The overt ones are really easy to see because you go, oh my gosh, I can't believe that somebody just did that. But the covert ones make you wonder, did that just happen? And is it just me or do they just not like me? So there's a couple different ways that people can get this in for you. How you can make employees gain their strength back is there are tools that you can give an employee ahead of time that if anything is said or done to them, they understand what it looks like. They can recognize what workplace incivilities look like, and they can respond to it in real time. It gives them that assertiveness and lets them take charge of the situation instead of being surprised that it happened. And then what you do is after you've given them the tools, you just need to practice, because it will happen at some point if 70% of nurses are saying that it's happened. So we just need to practice so that those responses are ingrained in us. What leadership needs to do is we need to recognize what workplace incivility is. We need to teach the staff what it is. We need to set clear expectations that this will not happen. We need to have zero tolerance. We need to treat people the same across the board. So if you are doing any kind of discipline, it has to match. And we really need to write policies because laws don't really cover this. And so what's going to help you is to have a policy in place that you can pull out and show to the staff when you're writing them up. So one of the things that we did at my work is we did something called My Promise. And what this is everybody signed it from the front desk, the lab, the radiology, and nurses and medics signed it to say that they understand that this is the expectation that happens when they're at work.